Alright, in this video we are going to review the setup of an arterial line monitoring system to be used in conjunction with the physician placing an art line. The major components that you will need for this will be a pressure bag, a 500 ml bag of saline, and special pressurized monitoring tubing that has a transducer so that you can hook it up to the monitor. The physician will be responsible or ask for what he needs for specifics in regards to placing the art line. Let's review where we can find these items. In the trauma room, you will find all of the equipment that you need for the placement. You have your arterial lines that the physician will place. There are kits. The physician may also have a preference to use an 18 gauge angio. You have chloropreps. You have your transducer cable for pressure monitoring. You have sterile gloves, and you also next to that have your transducer tubing. The only other component that you would need would be your pressure bag, and pressure bags are kept in your procedure cart right next to that cabinet. Once you gather all of your equipment, we're going to come back over here and Kathy is going to go through the procedure of setting it up. She's already removed the tubing from the package, and the first thing she's going to do, she's already clamped the tubing. The next thing she's going to do is check all the connections on the transducer tubing to make sure they are nice and tight. So at the stopcock, there are two different connection points. You want to make sure that those are all verified, that they're not loose. Once she's done that, she will go ahead and begin to prep the bag. In prepping the bag, you are going to do a two-part procedure. First you're going to do is you're going to spike the bag. Once the bag has been spiked, you will remove it. At that point, Kathy is going to remove all of the air from the bag itself, and then reinsert the spike, therefore eliminating the chance of any air getting in your tubing. Once the bag has been spiked, she's going to fill the drip chamber completely to remove all the air from the drip chamber. And then she's going to head over to the IV pole so she's got a working area. Now that your tubing is hooked up to the bag and all the air has been removed and the drip chamber is full, she'll begin by priming the tubing. I mentioned that there is a three-way stopcock, and at that three-way stopcock you are going to first turn the stopcock in the direction that would go to the patient or away from the directional flow of the IV bag itself. At that point, you will remove the cap that's attached, and then once that cap that she has is going to be thrown away because it has a hole in it. You do not want to use that cap. There are special caps. Once she has removed that cap and she has it open to air, the way that you prime the tubing or flush it is there is a little blue tab located right here, and that blue tab you will pull, which will open the system to allow fluid to run out. So go ahead. Okay, so that area has been prepped. She will then turn the stopcock in the direction of the open valve. She will use one of the special valves that comes with the kit. I told you guys would throw away the little cap that was on there because it is an open air cap. We do not want to use that. She will use the dead ender cap that comes in the kit, and she will hook that up, and then she will continue to prime it so that fluid actually runs out the very end of it to the patient's side. And we're good there. Okay, now that the tubing is primed, she will hook it up to a pressure bag. I'm fairly confident that everybody knows how to utilize a pressure bag, but you're going to place it in and then you're going to hang it from the little hang tab on the inside. And then she can just hang that up on the pole. At this point, what you want to make sure you utilize is there is a stopcock right here. You want to make sure that you turn it straight ahead so it's open to the air, and then she's going to manually pump up until the pressure regulator gets up to the 300 line, which is basically between the red and the green. Make sure you eat your Wheaties before you do this. Halfway there, Kathy. Keep going. Okay, once you get it up to that point, you are going to turn your stopcock off to the pressure bag, because if you don't, it will just continually slowly leak air out. At this point, we have our tubing that is hooked to the pressure bag, that is completely primed, clear of air, so we're going to move over to the monitor. First thing she's going to do is take the monitor off of standby. And I'm going to walk around so that we can visualize where you hook up the transducer tubing. The transducer tubing is inserted into IBP 1. You can put it in IBP 1 or 2, it really doesn't matter. But there's a little flange, so it only goes in one way. Now that that is hooked up, she is going to take the other end of the tubing, of the transducer cable, and she's going to hook it to the component for the tubing itself. Only goes in one way. If you try and it doesn't go, rotate it until it fits. Okay. You'll notice now that since she has added that cable, it now pulls up a transducer tracing on the monitor. Obviously it's flatlined right now because we are not hooked up to a patient. But you'll notice that it is already predetermined as a label as an ART. So you have your arterial pressure waveform already hooked up. So at this point, she's going to need to turn the dial to highlight your arterial section. Push the button, and it'll pull up label, ART, 0, scales, grid, color, or if you want to change it. So we're going to scroll down to 0. In order to 0, you are zeroing your arterial line tubing to atmospheric pressure. To do that, you are going to go back to that stopcock. You are going to turn the stopcock towards the patient, and then you're going to remove that cap, therefore opening it up to atmospheric pressure. If you turn the stopcock the wrong way, you're going to just let air come back into the system. So now that it is basically closed off to the patient side and open to atmospheric pressure, go ahead and hit that again. She's going to scroll back down to 0. And then go ahead and hit the button and it will 0. Wait for it, and you can see that now it says 0/0 instead of X. At that point, you can go ahead and close that again, straight up and down, and reapply that cap, make sure you maintain aseptic technique. We can go back and hit main screen or normal screen, and you'll notice that you have an arterial waveform already on your monitor and ready to go. At this point, you're basically going to wait for the physician to go ahead and place the line. Once he's placed the line, you will hand him the end that goes to the patient. And what I would reference, or what I would recommend, is that when you do that, before he hooks it up, you pull on this little blue tab while he is inserting it into the arterial. Therefore, it eliminates any air getting caught between the end of your tubing and the actual outflow of the blood of the arterial line. That is the basic setup of an arterial line monitoring system. I would also reference that you do want to know where your policies and procedures are. Your policies are found on the intranet under the policy stats section. If you look for a policy and you cannot find one in reference to what you're going to do, the next step would be to go to the nursing portal, and under your policy and procedure section, you will go to the Lippincott reference. And so when we do not have a policy, Lippincott is your next reference source. That is all.